Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
I'm Kerry Fink, and welcome to today's edition of Helping Seniors Television. This is the show that's designed to inform, educate, and connect you to resources that are going to have good value for you as we go through aging. And on behalf of our president and founder, Joe Steckler, who founded the Helping Seniors organization, a Florida nonprofit, and we started this out in 2011, and since then have been serving Brevard County and seniors and their families here with the Senior Information Helpline. It's that free call to 321-473-7770. And we call it senior navigation because as we talk about many times, as we grow older, really aging is on-the-job training. About the best you can do is try to listen to experts and learn things and tips and advice that's going to help you on that journey. And so today I'm really excited to talk with longtime friends of the Helping Seniors organization. Our guest today is Dr. Matthew Sheldon of Sheldon and Furtado, also known as Solid Bite. How you doing today, Dr. Matt?
Doing well. Thank you for having me.
So your dad not only has been in the past, he's been a board member, but he's been a longtime friend of the Helping Seniors organization. And you guys have really brought a level of professionalism and really good advice to seniors as they're looking at things. And I'm really excited about today's topic of the show. We're going to actually talk about something that seems a little bit maybe unusual, but I think it's going to have significant value for you in the fact that we're going to talk about some things you can do with cosmetics for your dentistry. And you know, a lot of times we think that means like, oh my goodness, I'm going to have to do a whole mouth replacement and all kinds of things. But I think today we're going to look at some ideas that could be not only affordable and helpful, but could really just change the trajectory of your smile. And I remember some years back, your father, Dr. Lee Sheldon, did a show with with Joe Steckler, our president and founder, where they were talking about working on creating the perfect smile. And I got to brag on Dr. Matt. One of the things that I read in your bio is that you were voted as one of the top 40 dentists under the age of 40. So number one, that's a great kudos to you, but it also had to make your dad proud too.
Yes, it was a very happy and surprising honor to get, and I love it. And you know, dentistry I've got many passions in my life, but giving people beautiful smiles is one of them. So,
well, I'm excited to dive into what we're going to talk about today because, you know, again, I think most of us, one of the challenges, we were just talking earlier today, there's a lot of seniors who are, maybe they're wanting to get back into the dating world, maybe they lost a spouse, maybe they're just at a place in their life like, I really don't want to be by myself. And so all of a sudden we start to look at our appearance and the things that might be important. Maybe we just want to go back to work and we've been maybe embarrassed about our teeth look or things like that. And there's some solutions that are really within reach. And so I love what we're going to talk about today as terms of some ideas that will be helpful. And I guess the first one we're going to dive right into is something that we hear the term, but maybe we don't understand it. Or maybe we see a commercial on TV and think, oh, it's really that simple. Yeah. But it's about bleaching. Talk a little bit about that.
100%. What you said is so true. You know, we live in a great county, and these days it's becoming more and more common for seniors to not only help their children and their grandchildren, and it's always kind of the me last generation. So finally, they're at a point where they said, well, let me take care of myself. Let me feel good about myself. And one of the simplest ways to do that, if your teeth look pretty good in general, is to whiten them or bleach them.
Wow.
So there's a couple different ways to do it. There's commercials out there, you know. The big toothpaste brands are always trying to reach the patient base, the patient population. So there's a lot of different stuff out there, and I'm here to educate on the type of bleaching that is out there.
Yeah, you know, I was thinking about that. I was having this comes to mind in our conversation. I was having this conversation with a hearing aid specialist who works really on the kind of the cutting edge technology of hearing aids. And I was asking him, I said, I see these ads on TV and they say, oh, you know, for this amount of money, you can have a fully great hearing aid instrument. I said, tell me the real truth behind that. Does that really work like that? Boy, did I get a real education that they're two separate categories completely. So I guess when we see these things that pop up on TV, like you can have whiter teeth in 2 weeks or whatever, they almost seem like a lot of those as seen on TV things where like there might be this much truth to it, but they're not really giving you the whole story, and it's not really quite that easy. Because we were just talking before the show, you were showing me some pictures of how like if teeth were all uniform, and there's all these dimensions you get in, and you talk about two different things. You talk about internal bleaching and external bleaching. So why don't we just dive in and let's try to get an education so we know how to react and what the best ideas are for us.
Sure. So the most common one you'll hear about and see is the external bleaching.
Okay.
So what's external bleaching? It's your teeth are naturally yellow, they're naturally a little bit darker. External staining, coffee, tea, cigarettes, wine, even fruit. Anything that can stain a white shirt is going to stain your teeth as well.
Wow.
So how can we fight that or combat that? Is with external whitening. Our hygienists do a really good job of cleaning the teeth and getting as much stain off in that time that you're in the chair to get your teeth clean as possible. But to take it one step further, is external bleaching. So you'll see ads for over-the-counter strips and stuff like that.
Yeah.
Those do an okay job. But the real factor is how long is that material going to be on your teeth to get them as white as possible. We're really happy with this system called KOR, K-O-R. They've got this patented technology where the material, the bleaching material, will go into a custom-made tray for your mouth, and the bleaching material, which is a form of hydrogen peroxide. That's what all the brands are out there, is a form of peroxide. The tray goes into your mouth, and it helps seal out all the external stuff, your saliva, anything that's going to creep in to destroy the whitening process. So we're really, really happy with this material from KOR, and it just, the longer it stays on your teeth, the whiter your teeth will get. A lot of people that try to whiten, sometimes they say, my teeth are too sensitive, I can't do this. With KOR, they come up with a desensitizer where you actually paint it on your teeth first, put the trays on, keep them on for as long as possible. Usually we want you to sleep with them, so it's working while you sleep. And within 2 weeks, your teeth are significantly brighter. So I have a couple of examples of whitening. And so what we love to do is we'll get a patient in, we'll take 3D molds of their mouth, we'll send those to the laboratory. The laboratory will make you trays that custom fit you.
Wow.
And then you'll whiten for 2 weeks at home. Then you'll come into our office and you'll have a in-office boosting session where it'll just take your teeth to the next level.
Wow.
I've got a couple of ladies in the office that do a fantastic job. I call one of them my bleaching queen because she wants patients to get the whitest possible teeth that they can get. So they go for the at-home trays first, and then they'll come in for a boost.
Wow. So when you do that, I guess part of the value and part of the reason that it's important to do it at an office is because everything is customized to your particular situation. It's not a generic one size, you go down to the drugstore and buy, quote, a whitening strip or something like that.
Absolutely. We want to take care of, the teeth have to be in a healthy state first. You can't be having periodontal disease or a lot of cavities or anything like that. So if you're going to the mall and you see a whitening kiosk, or if you see over the counter, you got to get a proper diagnosis, which we talk about a lot. Diagnose what's wrong with, if there's anything wrong with your mouth first, and then do the elective cosmetic procedures second.
Yeah, otherwise it would seem like you're trying to, I guess, whitewash over a deteriorating situation. It doesn't make much sense if you don't have the professional guidance to do it.
Exactly.
So there's another thing that you talked about. You talked about external bleaching, but what is internal bleaching?
So internal bleaching is usually will happen to one or a couple teeth from an accident, usually a childhood accident where your tooth gets banged. It doesn't get knocked out, but it gets knocked. It's called, your tooth is actually, it's a concussion.
Oh, wow.
The tooth doesn't physically move, but there's contact with it, and then the tooth dies. So sometimes you'll hear it as a dead tooth. So most oftentimes that tooth needs a root canal because the nerve has died. And then you'll see, like this gentleman in this photo here, you'll see this tooth just stays dark. What happens? From the accident, there was maybe some blood that got in there and really stained the tooth from the inside out. So a procedure for that single tooth is called internal bleaching, or another thing that you might hear is called a walking bleach technique. So you'll go to the dentist, they'll actually place the bleach inside the tooth, and then you'll walk away. You're walking while you're bleaching. You'll come back in a couple, 2-3 days, and as you'll see the before and after of this gentleman here, I saw him 2 or 3 days later, and the dead tooth that was dark actually started to blend in perfectly with what his other teeth look like.
So now then your smile is consistent. It's not like you have this, this one thing that's really standing out in your smile.
Exactly.
Well, and that's got to do a lot. I know we've done a lot of shows in the past with your dad, Dr. Lee Sheldon, where we've talked about, this always stuck with me because I remember seeing it in one of the seminars that you guys gave where he was showing a before and after. And he said this guy, he was a night security guard, and part of the reason was he finally made the decision he wanted to upgrade his smile. And so you guys went through and helped him with that. And I just remember the tail end of the story was it literally changed his life. It changed his employment, it changed his social status, and just getting out and having that confidence. It must make a big difference.
Big confidence boost. The big thing with bleaching, if we're talking about going the whitening route, is you do it and it gets your teeth white, but it's something you want to keep up with and maintain. Usually I'll recommend a patient one day a month will continue whitening their teeth just to keep that level of whiteness that they achieved from the initial go-around.
So now, when we talk about, cosmetics, obviously we're into a realm of choice, like I'm going to choose to this, as opposed to I have, this is something that's kind of like medically necessary because of the status of a tooth or something like that. But is cosmetic, when we're talking about bleaching, is that an expensive process?
No. Compared to other things in dentistry, as far as crowns or bridges or implants or veneers, whitening is definitely on the lower end of things, and that makes one of the biggest differences in the mouth. So, yeah.
Now I got to ask you about this. I'll see these things that pop up on TV where they're saying, "Oh, we're going to shine a light in your mouth, and that's going to whiten your teeth." Is there anything in all of that, or what?
There's been some studies on that because as the 90s was a big craze of cosmetics. So there were some gimmicks out there.
Yep.
And the truth is, actually, if you keep your mouth open for long enough, you're going to dehydrate your teeth anyways. So your teeth can naturally get whiter if you just walk around with your mouth open for a little bit as well. So the light shining on that, there's been mixed reviews on that, but it's the actual chemical on the tooth that's doing the job.
How about that? Well, the thing that we've been showing as we've been looking at some of these photos of actual, I guess, case studies, the thing that really jumps out at me is that, you could try something on your own. It was funny. We had this joke we had this motto kind of in the Helping Seniors world where we talk about getting your ducks in a row, which means making your aging plan, doing those things, setting out a timeline so that you're kind of ahead of the aging curve, not just always trying to catch up. But we said the second thing that probably is going to become like another anthem for us is we call it don't do this by yourself, because there's so many excellent resources out there, and it can save you a lot of time and heartache by going to the person who really knows what they're doing. So I guess my thought as I apply it to what we're talking about here is everybody's situation still is going to be different. Like I didn't even understand or think about internal bleaching like, well, I have this one tooth that I'm always embarrassed about, so I'm going to cover my smile. I didn't realize that there was actually help for those kind of things, and probably more cost effective than maybe most of us think.
Yeah, you bring up a great point there because everything is customizable. As we age, sometimes we have some more recession and gum loss, and long in the tooth is what they used to call it. But now we're selling these high-powered toothpastes out there that as our gums recede, if we use these high-powered toothpastes, we could actually, like sandpaper, we could rub away some of our tooth structure.
Wow.
So there's a table called the RDA, the relative dentin abrasivity. How abrasive is your toothpaste? So you can go
Wow.
online and look up the RDA of your toothpaste. The lower, the better. If you're just using a toothbrush and water, it's a 4. Some of those toothpastes out there are at the 200 to 250 range. So you're really kind of taking the sandpaper to your tooth and starting to rub it away on your own.
So we may be doing harm, not even understanding we're doing harm.
Exactly.
Well, that's the point. That's why you gotta ask the expert. Well, so we've talked a little bit about bleaching, but there's a whole nother side of this that we kind of broke into this conversation. We call it veneers and composite bonding. And I realize there are two different topics, but we're already kind of over my head in terms of understanding. I think I have an idea of what a veneer is, but I might be misthinking. So talk a little bit about, I kind of picture it as like something cosmetic that we're doing to my teeth to help me have a better smile or better color in my smile or things like that.
So if you have misshapen teeth, dark teeth, just not overall happy with your smile, but it's in a pretty good position, it's almost there, a veneer is very conservative. You're taking little to no tooth structure away, and it can be as thin as 0.3 millimeters. The contact lens that can fit over the front of your tooth and really enhance your cosmetics. It's funny because this material, it's made out of a glass-like dental material. It's very brittle when it's outside the mouth. You could crush it. When you start to bond it or cement it to your tooth, it becomes strong, almost as strong as your natural tooth structure.
Wow.
So yeah, we've got some fantastic examples. This one gentleman came in with these 2 front teeth where you saw a big black triangle right in the center of his front 2 teeth. And he smiles big, and it just looks like a dark hole in the middle of his front 2 teeth. So very conservatively, we adjusted his front 2 teeth, and now the color's good. We matched the color to his surrounding tooth structure, and that black triangle, that black hole is gone there.
So you kind of go from a smile that you're embarrassed of to like $1 million smile. I mean, it really makes a lot of difference. And you know, the thing that I think is encouraging to me, and I hope it is for you viewers, that you start to get a sense of not everything is like a complete full mouth restoration. There are definitely steps that you can, you know, as I always call it, it's like the 20% you can do that maybe gives you the 80% of the result that you're after. So what is the difference between veneers and then we talk about composite bonding? I don't even know exactly what I'm saying other than it sounds like by bonding, I think we're putting something on our teeth.
Yeah, the composite bonding is very conservative as well. It's the thing that the dentist will do in the chair with you in possibly one visit, where they are resurfacing your tooth, taking away a chip, a stain, something like that, and then adding some dental plastic, if you will, composite bonding to the tooth to reshape it and make it look good again. The downside to that is it doesn't seem to hold up as well as the porcelain veneers that will go to the laboratory will make in their lab, and then we'll cement it or bond it to the teeth. The composite is good for more minor things, and but it does seem to pick up stain a little bit better and wear a little bit faster over time.
Well, you know, here again, as we're talking about this, you're reminding me that this is again why you need the help of an expert, because I suppose as we sit down in your chair, you can really assess the situation and say, well, here's the most conservative approach that we can do to getting you here. And then you have a lot of different tools in your toolkit to make that happen. So it's not like, you know, here's a tray, go home, squeeze this stuff in it, and you have many more areas to work with. When you sit down with the patient, what's the process? Someone says, you know, I'm really not all that thrilled with my smile, but I'm still kind of on a limited budget. Can you work with me? What are the options that are available? I guess that's the kind of a conversation you have with a patient.
During our initial consultation with our patients, 100%, we want to know what bothers them the most. Give me your top list of things you want corrected, and let's go through these. If it's not feasible in this first visit, let's break these out into phases. Phase 1, let's get some of the disease under control. Step 2, now let's start approaching some of the cosmetic things. Sometimes they just need a little cosmetic work on a couple teeth, and then we can whiten the rest of them and blend them all in nice and naturally. and it saves them time and it saves them money. So yeah, breaking up, having that conversation and really coming up with a team treatment plan between the patient and the dentist is how we approach things.
You know, it's interesting because I do remember doing a Helping Seniors television show with your father, who's a periodontist, and I thought it was kind of unusual that as a periodontist, he did a show called Too Many Teeth Being Extracted, because you know, it was interesting because he's made the point over and over again, this is why you really need a good comprehensive dental exam so that you can really have a roadmap or a plan going out. It's not just somebody coming in and saying, oh, my tooth over here is hurting, can you help me? But to get a sense of where you are and where things are going. And I know when you guys bring in a new patient, because Dr. Lee Sheldon has explained, you guys spend collectively a couple of hours in that first visit because he says it's so important that you get a real sense from your side in terms of thinking of a treatment plan, what's going to help that person the best, but also it gives the person who's coming in for that help a chance to understand where they really are situationally with everything.
That's what I love about our office is the collaboration between my dad, a periodontist, Dr. Sheldon Furtado, a periodontist, myself, a cosmetic and general dentist, where you're coming in and you're getting 3 opinions right off the bat. Right. We were just meeting with an outside dentist last week who was discussing a patient maybe going to braces or not braces, and he said, the outside dentist said, I think all these teeth need to be extracted. We took a step back and said, whoa, we think we can save every one of these teeth.
Wow.
So we're getting a very different opinion out there. So we definitely want to sit down with the patient, diagnose, tell them the predictability of the plan. Is this going to be a short-term, medium-term, long-term plan for you? And then decide to go through with the treatment. So, yeah.
So let's come back to the concept of cosmetic. You know, I guess some people might say, well, that's kind of vain. I'm not really, I'm not really that concerned about it. But yet what we were also talking about is it has so many ramifications in practical life too. You know, I want the best social life I can have. I don't want to be embarrassed of my smile. I want to look good, you know, on my job, or I want to look good just if I'm going out for dinner or things like that. So it's not really that at all. It's not necessarily a symbol of vanity. It's just a symbol of you want to do the best that you can with making your smile good.
Exactly. Yeah. It's even when we started to talk about a little bit with tooth movement. Even if your teeth are a little bit crooked, it's that much harder to clean your teeth. So it's the greater likelihood of having disease.
Wow.
From the teeth being overlapped or crooked, rather than straight, healthy teeth, can make your teeth last longer as well. So, yeah.
Well, and then the second part of it is, as we've been talking through, it doesn't sound like cosmetic dentistry on the level that we're talking about. This isn't just for rich and famous. This sounds like there's some options for folks that say, I'm on a budget, I can afford to do a few things, but so people shouldn't be intimidated by that factor before they really sit down and see what's possible, right?
Does not have to be expensive. And when we're talking about the whitening as the least invasive, also probably the least expensive thing we can do for the patient, just give them that little boost of confidence, smile, it goes a long way. So you're right, it's definitely not only for the rich and famous.
Well, and that's a point that I want to bring out is there's been an association between the practice, Sheldon Furtado, Solid Bite, and Helping Seniors, which has been a great service. I know you guys work with a number of charities, but it's called Solid Bite Gives Back, and it's really been a blessing to us at Helping Seniors because it benefits the charitable organization, but it also benefits the patient because you guys have a program where somebody can come in, write a check to Helping Seniors of Brevard at the dentist, pay for that initial visit through a donation to the Helping Seniors organization. But what does it do? It gives that person a really deep understanding of where they are, because I think you go through everything with that patient when they come in and sit down, right?
Absolutely. So yeah, a $50 or more donation to Helping Seniors will get you the full examination, which is full mouth series of x-rays, a lot of one-on-one time. If you need a dental CT scan, which can go for hundreds of dollars, that's all included as part of the donation to Helping Seniors. So if you call 321-259-8000 and you ask for Jennifer, she'll get you set up with that charitable donation and exam.
Yeah, and as I've heard Dr. Lee Sheldon talk about it, he says really a benefit to you guys as medical professionals, because then you're not guessing at the situation. You have all the tools in front of you to make the best recommendations. So somebody says, I'm serious about getting my smile in order. I want to get back out there. I want to go start meeting some people. I want to be in more social environments. Boy, that brings back a lot of confidence. I guess you guys have seen it so many times in your career where somebody comes in, they're sort of afraid to even smile, and then after they've been with you and been through some cosmetic efforts like what we've been talking about, it just changes the game completely for them.
I've got so many before and after pictures of a patient coming in. We take some photos of you. He's hiding it with a big mustache, or he's just embarrassed with a smile. And then we say, let's take some after photos. Mustache is gone, big bright smile. It's just a game changer for the confidence. And you're right, it's what some people want, some people need, and right here in Brevard County we have it.
Yeah, and it's good to say that to get $1 million smile, it's not going to take $1 million. It's just going to take getting connected. So thank you, Dr. Matt Sheldon, for sharing time with us on today's Helping Seniors of Brevard TV show. Take a look at this. There are some great resources. The website for you guys is...
Yeah, if you go to www.solidbite.com, that'll take us there, and you'll see all the procedures we offer.
Yeah, you've got some great before and after photos and things that we've been talking about. So make sure that you take a look at that. Maybe let your friends know. Maybe something is helpful for them. And in all cases, we want to thank you, viewer, for joining us for today's edition of Helping Seniors Television. On behalf of our president and founder, Joe Steckler, I want to thank you, Dr. Matt Sheldon, for being here today.
Thank you so much for having me.
And we'll see you next time on Helping Seniors TV.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.